purpose of this video is to teach about the signs and symptoms, pathophysiology, and nursing management of tuberculosis patients. Tuberculosis is a disease that primarily affects the lungs, but can also spread to other organ systems such as the bones and kidneys. Once thought to be on the decline, rates of TB are increasing throughout the world, with the highest rates being seen amongst AIDS patients in Africa. TB is a disease of poverty and overcrowding. TB is caused by Mycobacterium tuberculosis, an acid-fast bacteria with a thick hydrophilic capsule surrounding it. It is this thick capsule that makes TB so difficult to treat. The thick cell wall of Mycobacterium allow it to live for extended periods of time on dried surfaces, only being able to be killed by UV light, heat, alcohol, or formaldehyde. Tuberculosis infection can occur in two forms: primary and secondary infection. Primary infection occurs when the bacteria enters the host's lungs and is detected by macrophages. Macrophages and lymphocytes then form a granuloma around the bacteria. Any bacteria that has not been killed by the immune response is held within the granuloma and forms a tubercle, which is filled with necrotic tissue and dead macrophages. These tubercles eventually calcify in the lungs and usually form within 6 to 8 weeks. But the bacteria inside the tubercle can remain dormant for years. This response depends on the strength of the host's immune system. The tubercles are visible in an X-ray. Several years can pass before primary infection turns into a secondary or active infection. This often occurs because the host has a decreased resistance to the bacteria, which reactivate in the tubercles and invade the surrounding tissues. As the bacteria begin to replicate, cavitation forms, which results in large open areas of the lungs, bronchi, and blood vessels. As the bacteria multiply, they spread to the sputum of the host and can be transmitted to others when the host coughs. In individuals with weak immune systems, such as children or immune-compromised patients, extrapulmonary tuberculosis can occur. This is a rapid progression of the disease process and can be spread to various organ systems. The signs and symptoms of tuberculosis depend on whether the patient has a primary or secondary infection. Primary TB is asymptomatic. Secondary TB, or active TB, manifests as anorexia, weight loss, malaise, fatigue, low-grade fevers in the afternoon, and night sweats. A consistent cough also develops and becomes more productive as time goes on, often resulting with bloody sputum. Primary TB can be tested for using a positive tuberculin skin test. The results may show a false positive if the patient has received the BCG vaccine or has had a previous positive test. To rule out primary TB, an X-ray would be needed. Active TB can be confirmed using an X-ray or CT scan, as well as an acid-fast stain or sputum culture. Often, an X-ray or CT scan is used. The first nursing care and intervention needed for patients with tuberculosis who are admitted to the hospital is to place the patient on airborne precautions in a negative pressure room and ensure that all staff or visitors are wearing an N95 or appropriate respirators when caring for the patient. The nurse will need to teach the patient to cover their mouth and nose when coughing and flush all tissues down the toilet. Identify people the patient has come in contact with and have them get tested for tuberculosis as well. Notify the public health department to ensure this is done. When the patient goes home, the nurse should encourage the patient to sleep alone, spend time outside, and make sure that their house is well ventilated. Of all the education the nurse is to provide, adhering to the drug regime is probably of the most importance for tuberculosis patients. A combination of drugs is given to treat TB. The combination includes a selection of isoniazid and INH, rifampin, ethambutol, pyrazimide, and streptomycin. All but streptomycin will be given for 2 months and then followed by just isoniazid and rifampin. These drugs are given for 6 to 12 months. Nurses should teach patients that these medications can cause peripheral neuropathy, hepatotoxicity, so they need to inform patients that labs will need to be drawn, as well as to watch out for signs and symptoms of fever and rash, because these could indicate Stevens-Johnson syndrome. The multi-drug regime for tuberculosis lasts 6 months to 1 year. Sputum cultures are often negative after 1 to 2 months of treatment, lessening the chances of transmission but not eradicating the bacteria. Patients with active TB oftentimes do not require hospitalization and can be treated at home. However, due to the long course of treatment and high noncompliance rate, the World Health Organization recommends that all TB patients participate in direct observational therapy. This means that a healthcare personnel must watch the patient take their medication daily. This is done to ensure medication compliance and to reduce the incidence of drug-resistant tuberculosis. On a personal note, I was in India 10 years ago when the World Health Organization's recommendation of direct observational therapy for TB patients and extended to the rural Santal tribal villages I was able to visit. Many of the individuals in the village had TB, and due to there being no medical facilities nearby, the village priest had their medications, and they had to go visit the priest daily to receive their medications, and the priest acted as their direct observational therapy to ensure medication compliance. Individuals who have come into contact with an infected person are given isoniazid prophylactically for at least 1 year, as well as getting skin tested periodically. I hope you have found this video beneficial in understanding the pathophysiology, signs and symptoms, and nursing care of tuberculosis patients.